I'm Tinabeth Pina. From education and increased public awareness to treatments, medical breakthroughs, and support groups, we'll sort through the confusion and break down the science of infertility. Science in You starts now.
I'm Dr. Max Gomez. It used to be if you were going to have an IVF baby, you had a pretty good chance of ending up with twins, triplets, or even more. Now science has virtually eliminated that risk with healthier babies and very high pregnancy rates. I'll tell you how it's done coming up on Science and You.
I'm Donna Hanover. When a woman can't achieve or maintain a pregnancy because of a problem with her uterus or her eggs, she may be able to turn to a gestational carrier or an egg donor or both. That's ahead on Science and You.
Acupuncture is just one of the many alternative fertility therapies that could be right for you. I'm Andrew Falzon. That story's ahead on Science and You.
I'm Anne Riddell. Beyond the physical issues, infertility can cause major emotional stress. A closer look at that ahead on Science and You.
Most people don't even realize that the most fertile of couples only have about a 25% chance of getting pregnant every month. So any type of issue, medical, emotional, or age-related, could dramatically reduce the probability of pregnancy.
So infertility is the inability to conceive a pregnancy within 12 months of trying. Anybody can suffer from infertility. In fact, about 20% of all couples trying to get pregnant are by definition infertile. The percentage of patients that experience infertility due to a male factor or a female factor is equal. So it's about 40% female, 40% male, and 20% is unexplained.
And what exactly is unexplained?
It doesn't mean there's not a cause of infertility. It just means that our testing is not able to identify the cause of the infertility.
According to the American Society for Reproductive Medicine, the specific causes for male and female factor infertility vary.
Historically, women were blamed for the inability to conceive. We now know that in a large proportion of circumstances, there can be a male factor, and the cornerstone of the evaluation is the semen analysis, where we're basically looking at the volume of the seminal fluid, the concentration, the amount of sperm, the motility of the sperm. When you're evaluating the woman, you need to have eggs, so you need to have an assessment of ovulation, and you want an assessment of normal ovulatory function. Then there's the anatomy. You need a normal uterus or a normal uterine cavity to allow an embryo to implant and continue to grow. You need tubes that are open. The tube is the location where egg and sperm come in contact with each other, and if there's any blockage, that will prevent one from getting pregnant.
Thyroid abnormalities and your age can also be factors.
At the age of 34, 32, the chance of having a genetically abnormal embryo with in vitro fertilization, you have to get the embryos out, is around 40%. So 40% of embryos are going to be genetically abnormal even at the youngest ages. At the age of 40, it's around 80% of those eggs are chromosomally abnormal, and at 42, it's over 90%. Women correlate getting their periods to being fertile, and we certainly know that's not true. Infertility or the decline in fertility happens 10 to 15 years before menopause ever occurs. Age of men also is important. However, male sperm counts decline starting with men that are around 35 years of age. But infertility or sperm function doesn't decline in men until after the age of 50 usually. So while in women fertility declines at around 35 in general, that decline is much more rapid and much more pronounced in women than it is in men.
While surgery or fertility medications can be effective in some cases, others may require intrauterine inseminations, also known as IUIs. If that doesn't work, an in vitro fertilization treatment, or IVF, is performed, where eggs are fertilized by sperm outside of the body.
What risks are associated with all types of infertility treatments?
The biggest and most obvious risk is a higher number of multiple gestations. Twins, triplets, quads, quints. We don't consider a higher order multiple gestation as a success. We consider that a complication. With each increasing number of fetuses, you increase the risk of complications in the pregnancy to the mother. Hypertension, preeclampsia, diabetes, preterm labor, premature rupture of membranes. And if these things are occurring to the mother, they're occurring to the baby.
Other risks include ovarian hyperstimulation and an increased risk of ovarian cancer if you're taking fertility drugs.
Let me put that in perspective. The risk of ovarian cancer, lifetime risk in women is 1 in 70. If you never have a child, never get pregnant at all, no pregnancy at all, your risk is 3 in 70. So it's a 300% increase in the risk of getting ovarian cancer, just the fact of not having a pregnancy in the past. In women who take their fertility drugs and get pregnant, their risk goes down from 3 in 70 to 1 in 70. The risks of fertility treatment are so low and the chances of pregnancy are so high with appropriate treatment in the, again, the appropriate population of women, that the risks certainly are significantly lower than the chance of pregnancy and definitely worth it.
Infertility treatments are not a guarantee that you'll get pregnant, and women need to follow the best advice of their doctors. I share in this very experience with many women. After I was diagnosed with unexplained infertility, I underwent 5 IUIs and 3 IVFs at 2 different practices. Sadly, none of the treatments worked for me, but there are many success stories out there.
It's just like a feeling you can't explain, just kind of like we finally did it after so long.
After 3 years of fertility treatments and miscarriages, Erica Antonis Gianetta and her husband had a son on their 3rd standard IVF cycle.
In the end, I have a greater appreciation for my son. The struggle made it that much more great.
The success rates associated with infertility treatments, especially IVF, vary and depend on many factors, including the clinic performing the procedure, the infertility diagnosis, and the age of the woman undergoing the procedure. For Science and You, I'm Tinabeth Pina.
I'm Dr. Max Gomez. You know, it's been 35 years since Louise Brown, the first test tube or IVF baby, was born. And since then, more than 5 million IVF babies have been born. In fact, today, assisted reproductive technology is producing healthier babies with higher pregnancy rates and far fewer treatment cycles. Here's how doctors are doing it. They make a big media splash. Octomom, Kate Gosling, and others having large multiple births. But fertility experts consider these cases a profound failure of IVF because any multiple birth, even twins, run significant health risks.
Twins have twice the risk of dying in the first month of life. They have 6 times the risk of cerebral palsy. They have 7 to 8-fold the risk of other serious complications that involve their central nervous system or intestines.
Carla Keckelreis feared those multiple births with IVF, but she had no choice. 2 ectopic pregnancies had destroyed both her fallopian tubes. So she volunteered for a study at Reproductive Medicine Associates of New Jersey that led to the birth of her son Brandon, and just Brandon.
The study was great because it would give us the ability, possibly, to eliminate having a multiple pregnancy, which was a little scary for us.
The reason most embryos don't result in pregnancy is that they are genetically abnormal, and doctors can't tell they're defective by looking at them under the microscope.
Even in your 20s, as many as 20 to 25% of embryos are chromosomally imbalanced. That number is 85 to 90% by the time you're in your early 40s.
So Dr. Scott and colleagues devised a test to analyze the chromosomes from the part of the embryo that was destined to become the placenta, which is genetically identical to the part that would become the fetus. The fetus is unharmed. That allows a transfer of just one genetically normal embryo, and therefore no multiple births. Better yet, as Carla found out with Brandon, the odds of having a baby with this one embryo technique actually go up.
Those embryos produce a baby, a live-born healthy infant, roughly 2 out of 3 times.
Another related advance that is dramatically improving pregnancy rates with IVF is the discovery that the uterus or womb has to be synchronized with the embryo that's developing in the lab in order for implantation and pregnancy to occur. Turns out that's easier said than done.
The uterus is really only optimally ready to allow an embryo to implant for 2 days out of each cycle. Now, in theory, nature would make that embryo ready to implant at the same time the uterus is ready to receive. But it is not always so, particularly in couples who are having a difficult time conceiving.
So it used to be that if a developing embryo didn't look quite right when the uterus was ready, it was thought that that was a bad embryo and it wasn't transferred into the woman. In reality, that embryo may just have been a little slow in developing and was perfectly viable. Solution?
If they're not in alignment, don't put the embryo back. It is much safer to freeze it, transferring it next month when that alignment occurs again, and you get outstanding delivery rates. We used to believe those embryos were inferior, and we were wrong.
It's the combination of advanced embryogenetic testing that results in single pregnancies like little Brandon, and the ability to freeze embryos for transfer into the uterus at the optimal time that has made assisted reproductive technology virtually as successful as the old-fashioned way of making babies.
We've seen giant increases in our implantation rates, and it's healthier children, higher pregnancy rates, fewer treatment cycles, better outcomes.
Other advances have focused on the precise reasons for infertility and for repeated miscarriages by working out the exact energy metabolism of the egg, the quality of sperm DNA, and how those two interact to make a baby. Seems it's a whole lot more complicated than that birds and bees lecture we all got from our parents. I'm Dr. Max Gomez for Science and You.
I'm Donna Hanover here at Reproductive Medicine Associates of New Jersey. Today we'll meet a doctor who's helped couples have children through gestational carriers or egg donation or both. We'll also meet a couple having their second child with the same gestational carrier who gave birth to their little boy. It's easy to see what devoted parents Rachel and Stephen Klein are to their son Brody. It took them many years to have a baby, even after going through procedures like in vitro fertilization.
I was able to get pregnant a few times, but each time I had an early miscarriage, an early loss.
Reproductive Medicine Associates of New Jersey figured out why.
Basically, I have what's called a unicornate uterus, which is a uterine anomaly. It's like I don't have the whole uterus that you should have. And with that, they suggested that a gestational carrier was probably our best answer because we had these healthy embryos. We had even done genetic testing on the embryos, so we knew that they were viable and healthy and strong, and we just needed a better or stronger uterus to put them in so that they could actually survive through a whole pregnancy.
One of the founders of Reproductive Medicine Associates of New Jersey, Dr. Paul Berg, says medical history is important in a gestational carrier.
They have to have had a child before, they have to have a good obstetrical outcome, a full-term delivery, no complications, no health risks. And then you want to look at the social issues. You want to make sure that she's in a good relationship, that she's a stable relationship, that she's in a nice home and has a steady income, and that she gets along with the intended parent. Because they do actually get very close.
The Kleins interviewed several women and found Kendra, who lives in Oregon with her husband Eric and their 2 children.
And for me also, it wasn't even just about her, it was about her husband and her family. And he was in the Coast Guard and was stationed out in Coos Bay, Oregon, which is where they met. And he was originally from Long Island. And I think all of that played into the process in my mind.
Dr. Berg says medical preparation for the gestational carrier is not difficult.
All we do is give her hormones to simulate a normal menstrual cycle, which is just pills and some injections.
And then comes the embryo transfer.
We had these 10 wonderful embryos. We even knew the sex of them. But
what did you say to the doctor? I want a boy?
Nope. We actually said we'd like you to choose the 2 strongest embryos. She flies to New Jersey, and we transferred 2 embryos to Kendra. And then a few days later, she goes back to Oregon and takes a blood pregnancy test, and she was pregnant. And it turned out that she was pregnant with 1, and it was a boy.
Why would a woman choose to be a carrier for another woman?
The women who are carriers are just, as a group, are wonderful people. They are caring, they really are into helping other women have families. And it's truly an altruistic mission for them. It is not about the compensation they get for their time and trouble. It really is about giving someone a gift that no one else could give them.
Laws about fertility treatment vary widely from state to state, and intended parents often look for a gestational carrier in states that allow compensation for her and their own names on the birth certificate. So the carrier may live too far for the parents to attend each doctor visit.
Anytime she had a doctor's appointment, we talked right after. She was great about sending us, if there was an ultrasound, she'd send us pictures, or she would always have all her facts from the doctor's appointment. So I rarely actually even followed up with the doctor myself, even though I had that access too.
The two couples became very close. For Brody's birth,
we were all in the room. Kendra, obviously. Her husband was next to her, sort of coaching her. I was sort of with the doctor, just front and center, waiting. I actually helped the doctor deliver Brody. What she had said to me was, you know, you didn't get to carry your baby, but how many women can say they actually helped deliver their baby?
And I cut the cord.
Unlike the Kleins, sometimes there's a problem with the woman's eggs, so those couples may turn to an egg donor. The donor egg and the sperm are used to create the embryo, which is then transferred into the uterus of the wife or a gestational carrier. The donor may be a family member or someone unrelated who gets compensation.
Egg donors are typically younger women between the ages of 21 and 30, 31, who go through the IVF process, taking fertility drugs that are daily injections. They have frequent ultrasound scans and blood work, and they ultimately go to a minor surgical procedure where the eggs are extracted. So it's about a 2-week commitment. It's actually a lot to go through for them.
And how complicated is the surgery for that?
It's a very simple procedure. The donors have anesthesia. They feel nothing. We put a very small needle into the back of the vagina, into the ovary, and aspirate, suck out the eggs. And it takes about 10-15 minutes.
Using a donor egg means the child has no DNA from the intended mother.
Nobody comes in here asking for egg donation. Nobody. It's always an option of last resort. So it is a big step for couples. But for them, it's more important to be parents. And the DNA and the genetics are less important. You know, it's about who's going to take care of that child, who's going to love that child and raise that child.
The cost of these fertility treatments is high, even when insurance covers some portions.
In New Jersey, there's a mandate that covers fertility treatment, which also includes gestational carrier. But an out-of-pocket expense for a patient who has no coverage using her own egg can easily run $40,000 to $60,000.
And using a donor egg?
A donor egg will add another $15,000 to that price.
When the Kleins thought about having a second child, they didn't have to go through another cycle of egg retrieval because they still had frozen embryos from the previous time. They hoped Kendra and her family would help again.
She did say that she wouldn't have, she didn't want to do this for another family. She wanted to do this because she wanted Brody to have the same place.
Would you like a baby sister or a cool car?
Cool
Cool car.
Couples looking into having a child through the use of a gestational carrier or an egg donor or both need to be aware that these procedures can be medically and legally complex. But generally, there is a lot of gratitude on the part of couples who have used these options to finally have a family. I'm Donna Hanover for Science and You.
I'm Andrew Falzon. Even though science can play a role in increasing your chances of getting pregnant with a variety of fertility treatments, for some couples, when all else fails, they're willing to try alternative fertility therapies.
I kind of waited, I think it was like 9 months, and I started getting really frustrated and decided it was time to start fertility treatments.
Getting pregnant would seem to be somewhat of a science, but for those who have tried without success, it seems to fall within the realm of being an impossible art. The process is obviously personal. When traditional medical treatments for fertility didn't work, Jocelyn didn't know what else to try.
And I went through several rounds of Clomid with IUIs, and nothing was working. And at that point, I was just even more frustrated and angry, and I couldn't understand why nothing was working.
After the ovulation prescription Clomid and artificial insemination, also known as IUI, both failed, Jocelyn's doctor suggested another fertility treatment, which has its roots in ancient Chinese traditions.
My doctor actually recommended acupuncture, and that's kind of how I found Angela.
Angela Lee has been practicing acupuncture since 1997. In 2010, she joined two renowned specialists in reproductive endocrinology. The result was their practice, Fifth Avenue Fertility, which focuses on a variety of alternative fertility therapies, blending the best medical techniques from Eastern and Western traditions, among them acupuncture.
It's used to treat fertility in a number of ways. One, it helps with blood flow. It can also help calm the nervous system, and it can be enjoyable for a lot of people. It's a time for contemplation, relaxation. A lot of patients will fall asleep. A lot of people will feel energized.
According to a March 2012 study in the medical journal Fertility and Sterility, acupuncture improved pregnancy and birth rates in women undergoing in vitro fertilization in China. Another study in that same journal shows the skill and experience of the acupuncturist has a direct effect on success. While results of other studies are mixed, we learned it wasn't uncommon for doctors at major medical institutions like Columbia Medical Center to refer their patients to acupuncturists when traditional approaches don't work. NYU's Medical Center offers acupuncture on site, but for Angela Lee, acupuncture is just one piece of the puzzle.
It's important to know what you're putting in your body. And so for me, it's about nourishing the gut, the cells, the nervous system. What you eat is affecting and impacting your overall state of mind and body.
Angela works with each patient individually to assess their diet and any nutritional deficiencies that exist. Some are corrected with natural foods or supplemented through an array of vitamins and minerals that are on hand. Sometimes correction means elimination.
I cut out gluten, dairy, sugar, soy, corn, peanuts, anything that was, processed. And after only a couple weeks, I just noticed a huge difference in my body. I just had more energy, I was happier, I wasn't as anxious.
Oftentimes, people will feel like, oh my God, this is so restrictive and I'm never going to be able to eat something, like cake again or something sweet. And it's not about rigidity. It's really about learning what helps your body function in an optimal way.
In addition to nutrition, Angela focuses on the patient's mind-body connection to help cope with the emotions that fertility issues can bring, something that she and Jocelyn worked on together.
It's one thing to feel like you have the answers, but you're going to seek some second opinions. But it's another when you completely feel like your body's betraying you, that you don't like yourself. Everyone's getting pregnant but you. It becomes very competitive.
We started diving into a lot of emotional aspects of my life and how I was kind of dealing with not getting pregnant and the feelings I was having about myself and about my relationship with my husband, and just kind of how I was approaching life. I was stuck in how I was viewing myself, my life, my relationship, and through the work that we did, she kind of helped me break down walls, and I really believe that that is a huge part of why I was able to get pregnant.
If you're looking for a way to increase your chances of becoming pregnant, perhaps alternative fertility therapies are right for you. Just be sure to check with your doctor first. I'm Andrew Falzon for Science and You.
I'm Anne Riddell. Infertility. Ask just about anyone who's been through it and they will tell you it's an emotional roller coaster. Struggling to have a baby can affect almost every aspect of life, from marriage and relationships to work. The stress is real and can feel overwhelming.
The worst emotional struggle I've ever been through in my life.
It's so hard when it's something that you want so bad and you just can't have it, and it's in your face that everybody else has it.
It's horrible when you have that, no, you're not, it didn't work, or, I'm sorry, it just didn't take this time. It's just like getting hit with a bullet.
3 women, 3 different struggles to start a family, and a shared understanding of how heartbreaking infertility can be. Maria and Carl Oliveri have been trying to have a baby for more than 3 years. They simply want what so many couples easily have.
I want a family. I want to take our kids to do stuff, go on vacation, take them to Disney.
After multiple rounds of fertility treatments, Carl and Maria have become experts on the emotional toll of that process. Normal life is put on hold. Even a simple night out can be hard.
We go out to dinner, we got to bring shots with us. It's like in the middle, having dinner with 5 people, we got to go to the bathroom
together and do
jam a needle, on a Saturday night.
I'm a woman. I mean, a man and a woman is supposed to be able to have a child like normally, and we haven't been able to.
And infertility can test relationships. Maria and Carl both worry about each other.
Whatever support you try to put out there, is it good enough? Is it not good enough? Am I saying the right thing? Am I not saying the right thing? Am I trying too hard? Am I pushing too hard? So there's a lot of second guessing.
I feel like every time I disappoint him.
But optimism lives in this house. The family collage holds a spot for the baby who is, for now, lovingly dubbed Stay Tuned.
Each cycle, whether it's failed or, whatever, it's not a step back, it's a step forward, a step closer to our dream.
Susan Stewart's adorable baby boy is evidence that science can, in some cases, make that dream come true. For Susan and her husband, IVF was successful, but getting to where she is now was heart-wrenching.
It was really, really sad, after the month after month after month. Always been such a positive person, and it really tested my optimism.
As Susan explains it, the hard part, at least at first, is the shock, because the ability to get pregnant feels like it should be a biological given.
You're taught that getting pregnant is so easy. It can happen just by watching a movie about sex. So when it didn't happen right away, after months, it just felt like something was wrong with me.
Then there was the isolation and the awful, even if well-intentioned, advice.
It's like people don't understand what I'm going through unless they've been through it themselves. I mean, I just found that again and again. It was like the advice that I got from people was often so insulting. Things like, just relax, or, just things like that.
All the men react that way. Grateful. It is the word that describes Susan now.
Any stress that we feel from being parents, because obviously there's a lot of stress from being a parent, we're like, but we wanted this, bring it on.
The stress of infertility is real. Research suggests women dealing with infertility feel as anxious or depressed as those with cancer and other major illnesses. That is no surprise to Becky Fawcett.
We did round 5 of IVF, and it worked. And at week 10, which was, believe it or not, Christmas Eve, 2004, I had a miscarriage. My third and final miscarriage.
Becky and her husband decided to adopt and now have 2 children, Jake and Brooke.
There isn't a moment that I don't look at my kids and see their birth mothers in their faces. And I will always love these women. I mean, these women saved me. They saved me. And maybe I saved them too.
As Becky learned, the emotional cost is compounded by the stress of the staggering financial cost. Becky explained she spent more than $80,000 in medical expenses, only to be followed by thousands more on adoption. Determined to make a difference, 6 years ago, Becky founded HelpUsAdopt.org. Her organization raises money and gives grants to help defray adoption expenses.
I'm so grateful for having this opportunity to adopt a child, not 1, but now 2. And I'm going to help. I wouldn't wish infertility on anybody, but I wish adoption on everybody.
Although obviously there are many ways to create a family, the emotional toll of infertility shouldn't be underestimated. We want to thank everyone who so candidly shared their stories with us, hoping their words might help others. I'm Anne Riddell for Science and You.
That's our show for today. I'm Tinabeth Pina. See you next time on Science and You.